ಸುಧಾ ಡಾಕ್ಟರ್ ಇಲ್ವಾ?
ಹಲೋ ಸರ್.
ಹೇಳ್ರಮ್ಮ, ಏನ್ ಮಾತಾಡೋದೇ ಇಲ್ಲ ನೀವು?
ನಂಗೆ ಕೇಳಿಸೋಲ್ದಾಗಿತ್ತು ಸರ್, ಈಗ ಕೇಳಿಸ್.
ಏನಕ್ಕೆ ಇದು ಏನ್ ಕ್ಲಾಸು ಅಂತ ಎಲ್ಲರಿಗೂ ಬ್ರೀಫ್ ಮಾಡ್ರಿ.
ಹಾಂ ಸರ್.
ವೈ ಇಟ್ ಹ್ಯಾಸ್ ಬಿನ್ ಸ್ಟಾರ್ಟೆಡ್?
Yes sir. Good afternoon everyone. We almost who are present in this meeting are Panchakarma PG scholars. So we are here to discuss about disease-wise Panchakarma. In detail about disease-wise Panchakarma daily according to Srotas-wise daily one disease will be discussed. According to that, Panchakarma treatment protocols are discussed here. Vaidya Vasant Patil sir here to hear in this meeting to enhance our knowledge about the Panchakarma. So I welcome you, sir.
Who is the other speaker? That also you have to tell, no?
Yes sir. I welcome Vaidya Madhuri madam for this session. Welcome you, ma'am.
Shall I start, sir?
Yes,
So
sir.
first I will brief regarding today's session. So today, as per the request of these PG students, we are going to start this means Panchakarma in Kusta. So the subtopics are basically speaking, you know, the Samprapti and Samprapti Vigata in Kusta. And then coming to that Chikitsa Sutra, line of treatment. So after that, the Panchakarma in again line of treatment, Samana Chikitsa Sutra and Visishta Chikitsa Sutra and Avasthanusara Chikitsa Sutra. In Panchakarma, again it is Samanya and Vishesha and Avasthanusara Chikitsa. Avasthanusara means Nava and Jirna are Gata Dhatu Gatatva. Based on the Dhatu Gatatva, that is also comes under Visishta. It is also Chikitsa Sutra. So today you are going to see this. I don't think in 1 hour it is going to complete. If something remains, it will be continued in the next class. Okay.
Yes,
So
sir.
basically, Kusta, as you know, one of the Ashtam Mahagada it is. Okay. So even though some Kusta, the Kshudraroga, in Kshudraroga also some stubborn disease which does not respond to the treatment, that also included in Kshudra Roga. And some Kshudra Kusta which seems to be Sidma, like example Sidma, Tinea versicolor, even though it is asymptomatic, in some cases only it is having itching. Even though it is asymptomatic, it has been included under Kshudra Kusta. So there are several such controversial things are there. So even then, you have to see where the Panchakarma is suitable. In acute cases, what to do. In subacute, what to do. In chronic cases, what to do. Who is the yoga? What is the Yogya Avastha for Sadhyo Vamana or Sadhyo Virechana? What is the Ayogya Avastha? What is the Yogya Avastha for Vamana Virechana? What is the Ayogya Avastha for Vamana Virechana? All those things, including all the means Rakta Mokshana, Shiro Virechana, even Basti also. You are going to see in this. So as all of you know that Kusta Sapta Dravya Sangraha, you know Vata Pitta Kapha and Tvak Mahasa Rakta Lasika. These Saptako Dravya Sangrahani Kusta. According to the permutation and combination of dosha and dusha, several kusta will be produced. Even asankhya, they have mentioned asankhya kusta can be produced like that. But here, majorly, they what they observed during that period, they have considered 7 plus 11 as Astadasha kustas. That will be deliberated here regarding the application of Panchakarma and along with some major rasayana shamana if possible. So that will be considered. So basically speaking, when you start with Shodhana, whether application of Shodhana, what is the Yogya Avastha? Bhavdosha Avastha is the Shodhana Yogya Avastha in Kushta. Still, whether Madhyama Dosha is contraindicated, whether it is contraindicated? No, Madhyama Dosha also it is indicated, but whether the particular Shodhana is going to benefit rather than producing any risk, etc. Even though Swastha also Shodhana is indicated, why not in Alpa Dosha Shodhana is not recommended? So that question arises. So the here the scenario even for Swastha also it is indicated. Even for secondary prevention also it is indicated. For example, to say primary prevention means one of the patient who is affected in family is someone has allergic dermatitis. Okay, that is one thing. So in that atmosphere itself is like that conducive for the allergic dermatitis in that house. So others can undergo Shodhana for the primary prevention of that particular disease. One thing. Second thing, Dadru is most common contagious fungal disease, as all of you know. In that also family members, it spreads to all other family members if it is if there is a contact. In such scenario, also primary prevention by Shodhana is also recommended with some Twak Rasayanas, Twach Rasayanas. Okay. That is primary prevention. Secondary prevention, already I told you, means seasonal. Some diseases are seasonal. To prevent that, secondary prevention is advocated. This is the secondary prevention in with special reference to Panchakarma in Kusta. Then, as far as the so there is no question of whether it is Bhavdosha only Shodhana is indicated or Madhyama dosha, Alpa dosha, etc. In Alpa dosha, you can manage with only Shamana Sneha. Even Madhyama dosha also, you can manage with Shamana Sneha followed by the if the patient is eligible, then Siraveda is enough. In Bhavdosha Avastha only, the Vamana Virechana Rupi Shodhana are recommended. Okay. So, as far as the Vamana is considered, Urdhva Shariragata Kushta, Kapha Pradhana Kushta, Kapha Pradhana and Pittana Vandi Kushta, even the Pitta Pradhana Kushta also, which is affecting Urdhva Desha, like sunburn, repeated sunburn, which is not responding to uh, the medications. In that case also Vamana is recommended, followed by Virechana. So this is regarding the Vamana in where which region of the body, which dosha involvement. There when to do the means Sadhyavamana. Sadhyavamana also again the question comes here. If the severity is very worst, means 3 plus, can do 3 plus all the thickness of the lesion and unbearable itching and all these symptoms are there like Shita Pitta, etc. Then Sadhyavamana, after that, when the dosha means severity becomes less aggravation, then you can go for Snehana and followed by then the regular Shodhana. That is some out of box thinking, and it is classically also indirectly they have advised whenever there is a abrupt dosha, excitation occurs, doshoklesha, it is happening at the level of twak here in case of Shita Pitta, etc. Shita Pitta. So in such a case, you can go for, along with that, some other symptoms like Rullasa, Praseka, etc. are there. Then you can go for Sadhyavamana in Shita Pitta patients. Likewise, in Virechana, it is indicated in Ado Sharirgata or Ado Nabhigata Kushta. So, in Pitta Pradhan Kushta, Pitta Kapha Pradhan Kushta, but Kapha should be in Madhyama Avastha here. Madhyama Ruddhi of Kapha is there, then only Virechana you can do. Pitta as a Pradhana dosha followed by Kapha dosha, then Pitta Kapha dosha both together. If it is there in Kushta, there also it is indicated. And especially when the Kushta is Gambhira in Mausa, etc., Mausa, Meda, Asti, Majja, even Shukra also, there, if the patient is fit for Vamana, then Vamana followed by Virechana is recommended. If the patient is unfit for Vamana, then after proper Pachana, you can go directly with the Virechana, followed by Rakta Mokshana. Okay? That is the treatment of choice you can have. Then coming to the Basti. Basti is only recommended when there is a Rukshata is there. Kleda is least present, least only, minimal. In such a scenario, only Basti is indicated. That too, it should not increase the Kleda and further vitiates the Kushta. That is the main criteria of selecting Basti in Kushta. Whenever there is a other symptoms, Vata Vyadhi, Kushta patient having Vata Vyadhi, in such a, for example, psoriasis patient having psoriatic arthritis, there also he is fit for Vata Pradhana Eka Kushta, the Patoladi or Panchatikta Gurta Gulu or Mahatikta Gurta Anvasana and Panchatikta Kashaya Vasti or this Tikta Kashaya Vasti or Mahatikta Kashaya Vasti or Aragvada Tikta Kashaya Vasti. All these are recommended. So then coming to Shiro Virechana, as you all know, it is recommended in the Urdhva Jatragata Vikara, example, especially photodermatitis or psoriasis, scalp psoriasis, or Dadru affecting the Urdhva Jatragata region, or the tinea capitis, what you call affecting the scalp, or tinea barbae affecting um, the beards. Okay, in that cases also it is repeated, chronic, recurrent, stubborn cases. It is recommended. So for that purpose and other things are many are there. Venga, Nilika, Kalitya, Palitya, all those things. If you consider Kshudra Roga in this category Kushta, then it is also recommended in such a case. So according to the Shiro Virechana is recommended only in Kapha and Pitta, Pradhana Vikaras. Pitta for removal of Pitta also it is recommended. Example, Nilika. Vanga as in Kapha Pradhana dosha will be there. So, like that, you can consider. And Rakta Mokshana, Siraveda, Prachanna, then the cupping modality, leech, Alabu, etc. They can be used according to the dosha. So this is one thing. Then at last, I am just before concluding this keynote. So Shodhana, where to adopt the Nitya Shodhana? For example, chronic skin disease, where there is a kleda is there, he is unfit for the snehana, there you can go for Nitya Shodhana. So some acute disease, acute kushtas, where you need instant remedy, then you can go for Sadhyomana or Sadhyo Virechana. That is called Sadhyo Shodhana. So Sadhyo Shodhana acute cases where the patient is expecting the instant relief, there we can go for Sadhya Shodhana. Then Nitya Shodhana, where the patient is unfit for Snayana, after Deepana Pachana or along with the Deepana Pachana, specific Deepana Pachana according to the involvement of the dhatus, you can go for. Along with that, you can give Nitya Shodhana. Either only one time, you have to morning time, you have to give Nitya Shodhana. It depends again. So according to the dosha, whether you want Ruksha Shodhana or Snigdha Shodhana, that also depending upon the case, you have to select. Then followed by Kramasha Shodhana. Kramasha Shodhana means Vamana Virechana. Okay. Basti, Nasya, and means Rakta Mokshana. This is Kramasha Shodhana. Then Doshanasara Shodhana. If Pitta Dosha Pradhana is there, so affecting the lower part, then you can directly start with after proper Pachana Virechana. So likewise. So this is Doshanasara Shodhana. So these are different types of Shodhana you can adopt in Kushta judiciously. So selecting the appropriate drugs. So which is we are going to discuss detail from now onwards. Dr. Madhuri, you can start now.
Okay, sir. Good afternoon, sir. Good afternoon, everyone. Myself, Dr. Madhuri. As sir said, Panchakarma plays a very important role
Your
in treating
introduction.
Kushta Chikitsa.
Dr. Ji, your introduction, please.
Sir,
Sudha, Dr. Sudha will
yes,
introduce
sir.
you.
Sir, my
Dr. Sudha will introduce you. She has not introduced you.
Welcome you, ma'am. Vaidya Madhuri, ma'am. She completed her PG in AMV Hubli, and presently she is working as a consultant in
Sharad Ayurvedic Medical.
Sharad Ayurvedic Medical College and Hospital. And I welcome you, ma'am. Yes.
Thank you.
I will introduce again because she has not collected the details. No, see, Dr. Madhuri Road is gold medalist. I think 3 or 4 gold medalists. 3 gold medalists from KLE Welcome when during her UG tenure. Then later in PG, she had presented several papers and got a prize under my guidance. And she is clinically, she is very good. And she is one of the, I think, as per I'm telling you, with a clever and with guts, I say, one of the best and means I can say first disciple I got in my teaching career. So she is going, that's why I given an opportunity to share her knowledge, whatever I taught to her and her batch. She is going to deliver it today. And I'll be there to clarify if something is needed. Okay? Okay. Dr. Madhuri Road, continue, please.
Thank you, sir. As sir told, role of Panchakarma plays a very important role in treating Kushta Chikitsa. But before going to the treatment aspect, it is very important to know the Sadhya Sadhyata and dosha involvement in Kushta Chikitsa. For 5 to 10 minutes, we'll understand the Kushta Vyadhi in brief, and then we'll start with the treatment aspect. As all we know, Kushta is mainly the Sparshanindriya Adhisthana Vyadhi. It mainly affects the 4th layer of Twacha. It is also considered as Mahagada. It is Adibala Pravritta Vyadhi, and it is Santarpana Janya Vyadhi also. It is Kleda Pradhana Vyadhi. The definition of Kushta goes like Kush Nishkarshe. Twachaha Kurvanti Vaivarnyam, Tushtaha Kushtam Ushanti Tat. It means the disease which has a spreading nature and which leads to the skin deformity, as means it is the discoloration of skin. So it is called as kushta. The nidana of kushta, we can understand nidana of kushta as aharaja nidana, viharaja nidana, and some nidanas are related with treatment, means improper treatment also. The aharaja nidanas involved the mithyahara, viruddhahara, use of adyashana, vishmashana, asatmya ahara, excessive use of mulaka, dadi, means the aharas which are mainly of which causes abhishandata in the body, they are responsible for the manifestation of kushta disease. Same way in viharaja nidana, the chardi nigraha, mithya vihara, divaswapna, these are involved. Then aushadha, like whenever the patient is taking any ashuddha medicines, like use of ashuddha swarna, ashuddha raupya, these also, the ashuddha sevan of these medicines also may leads to the complication as a kushta. And next, krimi is also one of the nidana for kushta. Same way, visha is also nidana. Bija dosha is also nidana. And then chikista apachara. Like first is panchakarma apachara. We all know in vamana ayogya, this vamana ashuddhi lakshanas, we'll get one sentence as tvacha vikara. So whenever there is ashuddhi or alpa shuddhi in vamana, it may lead to tvacha vikaras. Next, whenever we use snehana or svedana in improper diseases, and samsarjana krama apachara also, because after shodhana there will be agni mandya, and that time if we use any heavy medicines or guru ahara or use of any heavy medicines, it may also leads to kushta. Then few daiva apacharaja nidanas are also responsible for kushta, like papa karma or sadhu ninda, guru ninda, go hatya, and anya dravya apaharana. These are also responsible for the kushta disease. Now we'll see in brief regarding the Purva Rupas. There will be Asvedana, Atisvedana, Parushata, Vaivarnyata, Kandu, Nistoda, Lomaharsha. These are the Purva Rupas of Kushta. And then Lakshanas, that is Rupa. Rupa, that is Lakshanas of Kushta, are divided or understood based on doshas. Like Vata doshaja involved symptoms are different, Pitta doshaja involved symptoms are different, and Kapha doshaja involved symptoms are different. First is Vata doshaja involved symptoms. We may see Rukshata of the like Rukshata, Shosha, Toda, Sankocha, Parushata. These are, we will see as a Vataja predominant Lakshanas in Kushta Roga. And whenever we see Daha in the skin lesions, reddish discoloration of the skin lesions, whenever there is a Parisrava that is discharged from the skin lesions, Paka, Visragandha, Kleda, these are involved whenever there is Pitta involved. Pitta, Doshaja, dominance will be there. That time we'll see these symptoms. Then Kapaja, whenever there will be predominance of Kandu, Stairya, Gauravata, Stairya, the Shaityata, these will be seen whenever there is Kapaja predominance. Now we'll see in brief the Samprapti. Because of these Nidanas, there will be Tridoshaja Prakopa, because Kushta is a Tridoshaja Vyadhi and it affects the Saptadhatus. Means whenever there is excessive indulgence in the Nidana, there will be Tridoshaja Prakopa. This Prakopita Tridoshas then enters into the Tiryak Siras. Then they will affect Tvacha, Lasika, Rakta and Mausa. This Tvacha, Lasika, Rakta and Mausa Dushti causes Shlatana of the Dhatus, and these will cause Tvak Vaivarnya and ends up in the Kushta. After this, there will be involvement of other Dhatus also later on. So Acharya Shushruta has explained Dhatugata Kushta because of this Samprapti. In Samprapti Ghataka, it is as a Tridoshaja Vyadhi, mainly involved Rasa, Rakta, Mausa and Lasika as Dhatus. Here both Jatragni and Dhatvagni are involved. Rasavaha, Raktavaha, Mausavaha and Svedavaha Srotas were involved. Sancharasthana is Damani, Tiryakshiraha, Udbhavasthana is Amashaya, Vyaktasthana is Tvacha, and its Swabhava is Chirakari. Now we'll see the Sadhya Sadhyata. Sadhya Sadhyata is the Sadhya Vyadhis are divided into Sukha Sadhya and Krusha Sadhya. The Kushta, which is Ekadoshaja Kushta, Kapavataja Kushta, and Rasagata Kushtas are Sadhya. Kapha Pitta, Vata Pitta, Rakta, and Mausagata Kushtas, they were Krusha Sadhya. And Asadhya Kushtas were divided as Yapya and Anupakrama. Medogata Kushta comes under Yapya, and remaining, that is Tridoshaja, Asti, Maja, and Shukragata were Anupakrama. So after this Sadhya Sadhyata, we'll start with Chikitsa. As per Charaka Chikitsa, 7th chapter, 31st shloka, Sarvam Tridoshajam Kushtam, Doshanam tu Balabalam, Yathasvair Lakshanair Budva, Kushtanam Kriyate Kriya. Sarvam Tridosham Kushtam means Tridoshas are mainly involved in all types of Kushtas. Doshanam tu Balabalam is what? Depending on the dosha predominance, symptoms will occur. Symptoms will occur, and same way, Yathasvair Lakshanair Budva, Kushtanam Kriyate Kriya is what? Based on the appearance of symptoms, we need to decide the treatment based on dosha only. So,
Dr.
as
Madhuri, share the screen. No, if you have screen, you can share. Otherwise, if you don't have, you can.
Okay, sir. I'll share, sir.
Where cost, you can share.
Yes, sir. Yes.
So second sutra, what you have told. So
Yes, sir.
Yatha Lakshana means according to the Lakshana, you are saying. Okay.
Yes.
According to the Lakshana, there is two understandings. As you told us, simple meaning, straightforward meaning is Yatha Lakshana. So another meaning is whether it is Utthana or Gambhira. Whether it needs only topical application or oral. So, Gatatva Anusara. If it is Rasagatatu, only Lepa, Tvagatatva, Raktagatatva, Lepa plus Siraveda or local Rakta Mokshana. Then Masagatatva, there he says Lepa plus this Rakta Mokshana, then Kashaya, Sevana, and then Shodhana. Here it starts Shodhana. So likewise, you have to understand Yatha Lakshanam means. Okay? Next.
Yes. Next,
You can
we'll start
maximize,
with the
no?
show.
You can
Yes,
maximize.
sir. Yes.
Mhm.
I have only
Mobile, huh? Is it
Yes.
mobile or laptop?
No, sir. Mobile only, sir. Is the yes, sir. Now we'll start with Shodhana in Kushta Chikitsa. As per Acharya Charaka Chikitsa Sthana 7th chapter, Doshe Rute Apanite Rakte Bahya Antare Krute Shamane Sneheche Kala Yukte Na Kushtam Anuvartate Sadhyam. The meaning of this shloka is Doshe Rute means whenever there is whenever we do the dosha nirharana means after Shodhana, Apanite Rakte is after Rakta Mokshana. Bahya and Antare Krute Shamana means use of any internal or external modalities. Sneheche Kale Yukte means use of proper Snehapana. Na Kushtam Anuvartate Sadhyam means Kushta, we can cure the skin disease and it also prevents its reoccurrence. So Shodhana is very important in Panchakarma, and based on this, Shodhana will start the Snehana, Svedana, Vamana, Virechana, the importance of these Panchakarmas in Kushta Chikitsa. First is Snehapana in Kushta Chikitsa. We'll see Chikitsa Sutra first. Vatottareshu Sarpirvamanam Shleshmottareshu Kushteshu Pittottareshu Moksho Raktasya Virechanam Agre. Means Vata Pradhanaja Kushtas Sarpi, that is Snehapana is Sarpirpana is indicated. For Kaphaja predominance Vamana is indicated, and for Pittaja predominance Virechana and Rakta Mokshana is indicated. Now we'll start with Snehapana in Kushta. As per Acharya Shushruta and Acharya as per all Acharyas, Snehapana is indicated as first line of treatment. like tatra prathamameva kushtinam snehapana vidanenopapade. Same way, as per Acharya as per Ashtanga Hridaya, kushtinam snehapanena purvam sarvam upachari. Means snehapana is considered as a first line of treatment in kushta. But before planning the snehapana, it is very important to understand whether we are treating kledaja kushta or akledaja kushta, means ruksha kushta. Because as kushta is kleda pradhanaja vyadhi, where to stop the snehapana, to understand this point is very important. Like in Rukshaja Kushta, Snehapana can be continued till Twaksnigdata. Till we attain Twaksnigdata, we can give Snehapana in Ruksha Kushta conditions, like in Vataja Kushta conditions. And whenever there is Kleda Kushta, the Snehapana can be stopped till Kushta Snigdata only. Means Nati Snigdan Vireche, that the less of Snehapana is indicated in Kleda Bahula Kushtas. So this is Snehapana in Kushta. Here Shodhana Snehapana and Shamana Snehapana both are planned. Shodhana Snehapana are planned for dosha utklesha. Before planning any Shodhana Snehapana, any form of Snehapana, the planning of Rukshana, Pachana and Deepana are very important, because Rukshana, Deepana and Pachana are very important. And then this, after proper Snehapana, Shodhana is indicated. Then selection of Ghruta is also explained by Acharyas here. Like Samanya Paribhashaya Tailam Ghrutam va Vata Kushte Evam. Means for Vataja type of diseases, Taila and Ghruta can be selected. Then Kaphanubandhe Tailam. For Kaphanubandha, Taila are indicated, and for Pittanubandhe Ghrutam. For Pittaja diseases, Ghrutapana is explained. Annetu Panaya Ghrutam Abhyangaya Tailamiti. And for external purposes, this Abhyanga Taila are explained. These are the selection of snehas in Kushta. So, for Shodhana Sneha or for internal Sneha, based on doshas, some examples I will give here. For Vataja Kushta, Taila and Ghruta they have explained. So the Taila and Ghrutas which were made from Dashamula, Erenda, Meshashungi, etc. were used here in Vataja Kushta. And for Pittaja Kushta they have explained Ghruta. So the Ghruta which were made from mainly Tikta Dravyas like Tikta Ghruta, Mahatikta Ghruta, Khadira, Ragvada, they were used here. And for Kapaja Kushta, Taila were explained, like the Taila which were prepared from Nimba, Sapta, Chitraka, Kushta, Vacha, etc. were used here. And same way for Pitta and Raktaja involvement also, the Tiktaka, Mahatiktaka, Tikta Shatpala, Ghruta were used. This is what the this use of Snehapana in Kushta disease. So, in broadly, we can understand the Snehapana in Kushta as it is mainly indicated in Vataja Kushta. It can be done for Purva Karma as a prior form of Shodhana. It can be done for Paschat Karma, and it can be done for Shodhanantare. Like Vataja Kushta, Snehapana is involved. This we can understand. For Purva Karma, before Shodhana, it is planned. Paschat Karma means whenever there is Shodhana Karma, and whenever there is dosha nirharana, there will be balakshaya and vataruddhi. For that, as a paschat karma, snehana is indicated. Same way, doshana antare also to protect the prana of the patient and to maintain the agni and bala between shodhana snehapana is indicated. So overall indications of snehana in kushta are in vataja kushta as a purva rupa, as a paschat karma, and as a shodhana antare. So common used are this Dashmula Siddhagruta, Tiktaka, Mahatikaka, Nimbadi Siddhagrutas were used. And for Abhyanga, the main tailas used were Kanaka Kshiri Taila, Nimba Taila, Tuvaraka Taila, Eladi Taila, Nalpamradi Taila. These were used. Now this is Snehapana in Kushta. Now we'll start with Swedana in Kushta. Now we'll understand Sadhyosnehana Yoga for Kushta for Sadhyo Snehana, as per Acharya Shushrata, we'll get one reference here. Gramya Anupa Audaka, Mausa Guda Dadi Payatilan, Kushti Shoti Pramehimcha, Snehanena Aprayojet. Means when the patient is of Kushta, Shota and Prameha, for them the Mausaras of Gramya, Anupa Mausarasa, Guda, Dadi, Paya and Tila were contraindicated. For them, Snehaihi Yatartha, Siddhair Snehair Vikaribihi, Pippalibihi, Haritakyam Siddhair Tripalaya Apiva. For them, sneha should be prepared by using pippali haritaki. These were boiled with the sneha and it can be used. Same way, draksha amalaka yushabhyam. The sneha can be used along with draksha amalaka yusha and dadinam amlenacha sadet. Means yusha and amla dadi can be mixed and it can be used in kushta shota and pramehi. So these are the combinations which are used for Sadhyo Snehana in case of Kushta, Shota and Prameha. Here the common Sadhyo Snehana yogas were not used because Sadhyo Snehana is Sadhya Santarpakaraka. It may increase the kleda, so it is used along with these different drugs.
Just a minute.
Now
So,
we'll see.
Dr. Madhuri,
Yes, sir.
wait. So, where is the reference of Sneha, use of Sneha as a Paschat karma after Shodhana? So, not you, the participants or the students will answer. Dr. Akshata Madam will also answer. Dr. Akshata, you can answer this. It is there in Charaka, no? Anyone who knows, they can answer. Okay. Same, Shodhana, after Shodhana, it has been told. So, to protect the means Sharira and to protect the prevention of aggravation of Vata, Snehana is told. In the same context, it is there after Shodhana. Okay. Here also it is there, and generally it is there in the Siddhisthana. Okay. Especially in Kushta and Gulma, it is must. It is told. Okay. One thing. And whatever all the treatment, it is told for Vatottara Kushta, etc. These have been told. No, and they are the primary line of treatment. Secondary line of treatment in Vatottara Kushta, Basti is there. Secondary line of treatment in Pittottara Kushta. Apart from this, some case needs woman also. Okay, and so means if it is Urdhva Jatragata, it needs Shiro Virechana also. Okay, and likewise in Kapha, apart from Vamana, Virechana, Siraveda, etc., they are also secondary line of treatment. You should understand in that sense. Whatever these are the prime line of treatment. Rest are all secondary line of treatment. Okay. Sometimes these are also unfit for patient is unfit for this prime line of treatment. In such a scenario, the secondary line of treatment becomes the prime line of treatment. Okay. According to the suitability of Roga and Rogi. Then clear this Snehapana, regular Sadhyo Snehanayaga, whatever the classical Sadhyo Snehanayaga has been told, they will increase the Kledata in the body and that will causes Sneha Vapat like Shota or Galit Kushta. Galit Kushta means decaying or decomposition of that particular part of the body where the lesion is there. That will happen. Or cellitis, Visarpa like that. Okay. Visarpa, it may happen. Ronashofa or Galit Kushta or the gangrene, acute gangrene may happen. All these are the complications of giving Sadhyosnayana yogas in case of Kushta. Next, continue.
Yes. Now we'll see the Svedana in Kushta. We'll get the reference in Charaka Chikista 7th chapter. Stira Katina Mandalanam Swinnanam Prastara Pranadibihi Anupavarijanam Mausanam Pottelahi Sukoshnaicha. Means whenever these are the indications of Svedana in Kushta. Whenever there are Stira, Katina and Mandala Kushta is there, whenever we'll get the symptoms of these type of lesions, we'll use Prastara and Nadi Sveda. Whenever there is Utsanna, means by using Anupavarija Mausa, Pottali Sveda is done. And in practically, we can use Avagaha Sveda and Parisheka Sveda in Kushta. And it is Svedana is contraindicated in Pitta Pradhanaja Kushta and wherever there is Shlatita Dhatus, means whenever there is the deep-seated Kushta is there this Svedana is contraindicated.
And then
Uttama Sveda
also,
is contraindicated.
and also Galit Kushta. Galit Kushta means decaying.
Yes.
Okay, there also, and Kleda Pradhanata is there. There also it is contraindicated. Pitta Pradhana, Kleda Pradhana, Galit Kushta means Gambhira Dhatugata, Saruna Kushta. There are again Saruna Kushta means open lesion, having wound like, okay, Saruna Kushta. In such a lesions, you can't do these Svedas, especially Mahan Svedas. And in such a scenario, as told, Parisheka Sveda, like Siddharthaka Parisheka Sveda, or you can take n number of drugs are there, Kushtagna drugs, Kushtagna Mahakashaya, you can make it, or simple Aragvada Patra Kashaya also you can do, Kashaya Seka, that is also there, or Snanam, Ushna Jala Snanam, nothing is possible, then last is Ushna Jala Snanam, okay? That is enough. Ushna Jala Snana and another one, Guru Pravarna. Okay? Anagni Sveda, Guru Pravarna in such a scenario. So it does not mean that Guru Pravana, it has to be done immediately. So it continuously you are doing, no, that will be there. Whenever you cover the blanket, thick blanket, 2 hours, 3 hours, it will act like a Svedana, 1 hour. Okay. You can 2 times also. Patient should be continuously 2 to 3 hours Guru Pravana. That will also help in Svedana in such a scenario. Okay. Ushnagraha also. Another option is Ushnagraha.
Here Svedana.
Continue.
Yes. Here we can understand Svedana as use of Shodhananga Svedana and Shamananga Svedana also. Like before Shodhana will give Abhyantara Snehapana and Bahya Snehana and Svedana. That is Shodhananga Svedana. To get the Svedai Dravatvam Prapyam, for that reason we do the Shodhananga Svedana. And as Shamananga Svedana, like we'll get this reference in Sushruta Chikista, that is Tatra Samshamaniya Sameshu Vadishu Ruksham Eva Yojah. In Samaha Vyadhi and to get the Rukshata, we'll do Shamananga Sveda here. Now we'll start with Vamana in Kushta. We'll get this Chikista Sutra in Sushruta Chikista, 9th chapter, that is Pakshat Chardanani Abhyupapeyam Masan Masam Sramsanam Chapideyam Sravyam Raktam Vastarehi Dvir Pam Nasyam Dadyacha Triratra. Means Vamana should be done in once in a 15 days. This Virechana should be advised once in a month. This Raktamokshana is done twice in a year. And Nasya is done for 3 days. After interval of 3 days, this Nasya is done. So we'll start with Vamana in Kushta. Vamana in Kushta, the main indications of Vamana in Kushta are whenever
wait.
there is
Doctor,
Pradhana
wait.
Kushta.
Madhuri, wait, please wait.
Yes.
So you have to clarify, no, how it is practically administered. This, okay, Pakshat, how it is practically implemented. What is your understanding? I already told this.
Yes.
How you are going to practically employ in a given case of Kushta. So pakshat means what do you mean? If the patient requires 2 Vamana, and then wait for 15 days. Okay. After 15 days, you are doing second Vamana. So second Vamana completed, when Kapha, Tridosija Kushta is there, when Kapha is completely come down, Kapha symptoms, thereafter you go for Virechana. Okay. So third treatment is Virechana here. Virechana, Pitta symptoms still come down, you have to continue. It may require 2 months, 2 Virechana or 3 Virechana. Okay. Masat. After Virechana, you go for Siraveda. Okay. Then Siraveda, that is again here subject to before Siraveda, you have to go for Shirovirechana. Shirovirechana, every third day it has been told. Every third day till that particular means, especially Urdhva Chaturgata Vikara, Kushta. These are all the means Tridosis Kushta having all over the body, systemic of involvement. In that scenario, it is told. Okay. This Chiksa Sutra is applicable. After Virechana, 2 to 3 Virechana, or it may require 4 Virechana also. So it is around 4 months plus 1 month to Vamana. Almost after 5 months, you are going to means administer which one? Shiro Virechana. Thereafter, you are going to use the Siraveda. Okay? Siraveda means first if you administer one Siraveda, after 6 months, second Siraveda you have to administer. Okay? This is the most possible way of administering or implementing this Chikitsa Sutra. Okay? Another one is, so if you are the dosha bala, kapha, as I told, kapha, pitta are like this. Means kapha is 3 plus and pitta is 2 plus. In that scenario, it will work like that. So if the kapha and pitta both are same, and also if the means one vamana, after vamana, you do one virechana, then again one vamana, one virechana. Like this, according to that, you have to do. But the gap they have given, that you have to follow. That is one thing. So if there is a scalp, another one example I will give. Shiravirechana, if needed, so the scalp psoriasis is more severe. There is a more severe involvement of Urdhva Chaturgata sthana. Then immediately after Vamana, you can go for the after Vamana Virechana, you can go for one Vamana and one Virechana. You can go with the Shiro Virechana. So according to the severity, dosha involvement, and the desha involvement means Rogi desha, means region involvement. You have to select the particular Shodhana, and then according to the interval they have advised recommended, that interval you have to follow in order to protect the strength, bala of the patient and prana of the patient. That interval is they have recommended. Okay, this is how you have to understand this pakshat etc. Chiksa Sutra. Okay, any query in this regard? Any query?
No, sir.
If you have any doubts, means understood. I hope you understood. No, everyone.
Yes, sir.
Madhuri, continue.
Yes, sir. Now we'll see the indications of Vamana and Kushta. Vamana is mainly indicated whenever there is Kapha Pradhana Kushta, first thing. Second is when the Kushta is situated above Napi Pradesha. And whenever there is Dosha Utklesha is in Urdhva Bhaga of Amashaya, then also Vamana is indicated. And Vamana is mainly indicated in Rasagata, Mamsagata, Medogata, and Raktagata Kushta. And in Vasanta Kala, mainly for these kind of diseases, Vamana is indicated in Kushta. So these are the indications of Vamana in Kushta. The yogas of Vamana. as per Acharya Charaka and Ashtanghrudaya, the mainly Madanaphala, Vacha, Vasa, Patola, Nimba, Priyangu, Madhuka, use of Uttaja Bija, Kruta Vedana, and Ikshvaku Phalamadhya with Mastu. These are explained for Vamana Karma in Kushta. These can be used as Kwatha along with Madhuka. These can be used as Leha or used along with Mausarasa, etc. can be used in Kushta disease. This one more special indication of Vamana in Kushta, that is Doshotklesha Hridayomeva. Means whenever there is Dosha Utklesha in Hridaya Pradesha, Vamana is indicated by using Uttaja, Madana, Madhuka and by using Shitarasatmaka drugs. Whenever we plan Vamana Karma for patient, there we need to understand two things, that is Natisnigdam, this proper sneha, whenever the patient is having proper snehapana and whenever the patient is balavan, that we need to go for complete akantapana and then Vamana is indicated. Same way, whenever the patient is sukumara and bala is less, then complete akantapana is not needed, and that time yavagu is used before Vamana karma. As Vamana helps in removing the kledata, it is helps in kapanirarana, it is also giving the results as Indriya Prasada, Mano Prasada, Tvak Prasada. So Vamana plays a very important role here in Kushta Chikitsa. Because in Vamana shloka only will get Kedara Setu, Bhadesha, Alyadya, Shesha. Here the Vamana is mainly indicated for Kleda Nirharana. So Vamana plays a very important role here. Next is Virechana Karma. The main indications of Virechana in Kushta are first is Pitta Pradhana Kushta. Whenever the Kushta is situated below Nabhi Pradesha, Dosha Utklesha in Adho Amashaya and Pakvashaya. And as per Acharya Sushruta, Masat Virechana is used. So the main yogas used here is by using Trivrut Leha, Danti, Manibhadra, Guda, Saptala, Shankini. These are the combinations we'll use for Virechana. And here in Virechana, whenever the patient, whenever there is Sneha Utklishta Sharira will be there, then we need to go for Ruksha Virechana. Whenever there is Sneha Kshina Sharira, then that time Snigdha Virechana is used. And next in Virechana, we'll see the use of Nitya Virechana as per Acharya Sushruta. Pratah Pratascha Sevet Yogan Vairechanan Shubhan Pancha Shat Sapta Chastavva Her Uttanam Na Gacchati. Means usually the Nitya Virechana medicines are given in morning times, but nowadays we are using it in night time, and it should be given up to 5 days, 6 days or 7 days, or up to Dosha Shamana it can be given. So it is made, Nitya Shodhana is very useful in it is very practical because we can use it in Avarabala patients, and we can use it in Avarabala patients, and in Bala and Ruddha patients also we can use Nitya Shodhana. And the common drug we use for Nitya Shodhana is Manibhadra Guda is commonly used here. Next is Ubhayato Shodhana. It is explained by Acharya Sushruta. Tatra Purva Rupeshu Ubhayata Samshodhanam Aseviv. It is explained in Purva Rupa Avastha of Kushta. Both Vamana and Virechana are indicated in Kushta Purva Rupa Avastha. For this, commonly Danti Gruta and Tuvarakatail etc. medicines were used. Then after Vamana and Virechana, Samsarjana Krama is also explained to maintain the Agni, because Samsarjana Krama Apachara is also a main cause for Kushta. So maintaining the strict and sequential dietary regimen is very important to after Shodhana Karma in Kushta. Next is Nirva Basti Prayoga. Usually Astapana Basti.
Dr. Madhuri, just a minute. So Nitya Shodhana, here Pancha Shat va how many days? Sapta.
Yes, sir. Sapta cha ashtavva. Yair
Astava.
utthanam na gacchati. हाँ sir.
Yo
Yair
last.
utthanam na gacchati.
Okay. So the duration told by Acharya Shushruta here for Nitya Virechana, this is for Balawan patient, and you are expecting more than 4 or 6 vekas here. Every day you have to give some Sarjana Krama every day. Okay. So whatever it is there, two Annakala you can give like that. Okay. Afternoon, whenever he is having Shuddha, etc., whatever the Samsarjana Krama rule is there, likewise, or one time you can give, and next day also again you have to give the Nitya Shodhana drug. So whenever it is the Vega or more than 5, then 5 to 10, you can say. At least hour, what you say hour is 0 means at least up to 10 is considered as hour. So till that number 10 is considering that he has told 8 days is maximum for Nitya Virechana. So when you are giving for Ruddha, etc., or Sukumar or Avarabala patients, then you are expecting 2 to 3 Vega, then you can give for longer period, 15 days, 20 days, 30 days, like that. Okay. This is how you have to practically adopt the Nitya Virechana. Okay. And other than this, as I told, those who are not fit for the Sneha Sweda Purvaka Shodhana, their Nitya Shodhana is indicated. And after regular Shodhana, to prevent the accumulation of dosha, further accumulation of dosha in particular season. For example, Sharad Rutu. Sharad Rutu, due to Pitta Prakopa, there is a chance of the Pitta Pradhana Kushta. In such a scenario, and other Kushta also, there you have to give, first you have to do the regular Shodhana, if patient is fit for that. Then, if there is some dosha remained or there is chance of accumulation, then you can go for Nitya Shodhana also. Okay. This is how you have to understand the application of Nitya Shodhana in Kushta patients. Okay. So it may be he may be ayogya for the Sneha Svedapuraka Shodhana, and the all the pancha means Vamanadi, Pakshat, etc. He may be unfit for that also. In such a scenario, you have to adopt this krama, which is called Nitya Shodhana, that is Nitya Virechana. Okay. That is one of the things we have to follow here. So I think now it is very clear where to give Nitya Shodhana, when to give, and how to give. Okay. So it is must after, even if you get 2 Shodhana also, 2 means loose motions or 3 loose motions also. Here also you have to give Yavagu or Peya. Okay. That is must according to the type of Kushta, everything. So dosha, etc. You have to select a particular Patya Kalpana. Otherwise, if the patient takes hard food, then there is no sense in doing all this Nitya Shodhana, etc. Okay. After that, there is chance of Agnimandya and Ama formation and aggravation of the condition will be there. So always follow Patya Kalpana, means Peya or Yavagu or Yusha, etc. according to the dosha involvement after Nitya Shodhana. Okay. Now I think it is more clear for everybody.
Yes, sir.
Only one person is responding, all other are idle. Huh? Not speaking. Upanishad has joined. Upanishad is silent.
Sir, actually, sir, we are sitting beside only, sir.
Where you are sitting?
In the department only, sir, we are all sitting here only.
If you are sitting in department, you can speak, no? There is no
Yes, sir.
Restriction.
On behalf of us, Sudha will be speaking, sir.
No,
On
nothing
behalf
like
of
that.
us, Sudha will be speaking.
No, nothing like that. Nothing like that. You can, if somebody has queries, then you can ask directly. No chat box
Yes, sir.
is allowed here. Okay? You can interrupt at any time.
Yes, sir.
At any time. At any time.
Okay.
I think today's time is over. How many slides remaining?
Sir, Basti, Nasya, Raktamokshana and Upakarmas are remaining, sir.
Tomorrow you can continue, no?
Yes, sir.
Tomorrow you can continue.
Yes, sir.
Or you would like to continue now? Tomorrow is it okay for you? Dr. Madhuri ji.
Sir. Tomorrow I'll continue, sir.
Okay.
Yes.
Next disease, which one? Which one you would like to have?
Me, sir.
No. For others, learners.
Yes.
Tell now only. Another
Sir,
one senior will
Raktapitta.
take Raktapitta. Raktapitta you want? Huh?
Yes, sir. Sir.
So, give some other disease, no? Practically applicable, usable.
Sir, Vatavyadi.
Vatavyadi. Dr. Akshata Nayak will take Vatavyadi. From Sunday is off, no, Monday. Monday, 3 to 4. Dr. Akshata Nayak, madam. Is it okay, Dr. Akshata? Okay. ಆಯ್ತು. Okay. So tomorrow we will continue, no? You come with
Yes.
question, come up with questions, then we will complete this tomorrow, everything remaining. Okay?
Yes, sir.